You might think, why would an audiologist need to be involved with the deaf? They already can't hear, so what more could I do as an audiologist? There are still many, many ways audiologists and other ear care professionals can be involved in the care for those who are deaf. Some persons who are deaf still wear 1 or 2 hearing aids or cochlear implants. They still also need general ear care health. They may need letters for government organizations and much more. General ear health and care are somewhat overlooked in the population, as hearing is one of those senses where issues can be easily overlooked by the patient, their family, and in some cases by their doctor. The World Health Organization Training Manual is a wonderful resource for the prevention, identification, and management of hearing loss. The manual is targeted towards healthcare workers and primary care doctors and seeks to ensure that hearing health does not get overlooked and is included in the general health checkups for patients across Barbados, whether hearing or deaf, because we all have ears and we all need them cared for. Regarding the training manual now, there are 10 modules in the manual, and it's organized in a way that assumes a very basic level of knowledge coming in and hopes to equip the healthcare professional by the end of the manual with tools to first identify if there is a problem with the ears and whether the issue is something more obvious like an ear infection or wax impaction, which basically means if your ears are full of wax, or something less visible like a hearing loss, and where and when to refer them. Because if you're just looking at somebody, unless they are deaf and they are obviously signing or showing signs of a hearing loss, you would never know if somebody had a hearing loss just by looking at them. You need to do further testing. We use the term early intervention with children typically wanting to ensure that a child born with hearing loss gets amplification as soon as possible. But this can also be extended to the general population. Most of us experience hearing loss as we age, but too many wait too long to seek care, and I see that all the time in my clinic, where persons are just waiting too long. They're waiting till the problem gets extreme in order to at that point act. I see many ways this manual can be used, and I'm hoping that this event will spark ideas and connections on where to start planning implementation. For instance, as one of the few people on island seeing people for hearing health, I can see an increased need for early screening at birth, in schools, and more periodically throughout a person's life in order to better identify and manage ear health, no matter how that looks.